Hey, good day, everyone. Today we're going to talk to you about the story of DECYDE, which is our drug education strategy that we've created. My name is Lisa Bishop. I am a pharmacist and I'm a professor at the School of Pharmacy at Memorial University. And I'm joined with two other colleagues who will be presenting with us. Will?
Hi, I'm Will Lummis. I'm a social worker, and I am working as a regional addictions prevention consultant with Newfoundland Health Services on the mental health promotion and addictions prevention team, and I'm also a pediatric counselor.
That leaves
Hey,
me.
Virginia.
I'm Virginia McNeil. Hi, Virginia McNeil. I'm a high school teacher in Clarenville, and I'm also a grad student in the Masters of Education, Counseling Psychology, and I'm lucky to be on board as a research assistant with the DECYDE program.
Great. So first, before we get started, I would like to acknowledge the lands where this work was conducted, the lands on which Memorial University's campuses are situated, and the lands in which we live, study, and work are in the traditional territories of diverse Indigenous groups, and we acknowledge and respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of Newfoundland and Labrador. So we're going to share with you our work. And first, we're going to start and share some of the stories that we heard from people in Newfoundland and Labrador. And then we'll talk a little bit about how that shaped our drug education strategy. And then we'll talk a little bit at the end about our next steps moving forward. So first, to get started in terms of really thinking about all the work that we did, listening to people, doing some research, and really helping that inform the drug education strategy that we developed for youth. I guess first off, when we think about Newfoundland and Labrador, we have one of the highest drug consumption rates on alcohol and cannabis in this province. And in particular, looking at grades 7 to 12, the rates of substance use are higher than the national average. And the age of first use for alcohol, cigarettes, and cannabis is 13 to 14 years old, which is pretty young. And looking at our province as well, we have the highest alcohol amongst all of the substances in the province. And we do know that alcohol use or alcohol and substance use is increasing across Canada as well as in this province. So I just want to share some of the work that we've done. 3 years ago, we did receive funding to look at cannabis policy evaluation in this province. And we did a lot of consultations with stakeholders, with citizens, with educators, and youth and young adults. And a few things that came out of that was that we do need to invest in education for our youth. And cannabis was a big gap, but as well other substances. And we also identified the need for educator professional development, especially supporting them around knowledge around harm reduction and substance use. And they're dealing with that in the classrooms and in the schools. So that's really what informed the initial stage of us going down this path of developing a drug education strategy to support teachers in particular in the delivery of substance use education. So we've done a lot of work since that original needs assessment and that original grant that we received. We've done focus groups with youth and young adults across the province. We did a scoping review looking at educational materials and programs that are offered across Canada. We've done a lot of community and citizen engagement. We have a youth advisory panel, and we've had workshops with youth. We also spoke to teachers through focus groups as well as a survey. And of course, looking at evidence and best practice. So all of that has really shaped what we've developed, and we'll share some of that in a little bit of what we did develop. So meaningful engagement is the core of what we do. So we counted up about 130 consultations that we've had with external people to date. And this is a interdisciplinary, diverse group. We have collaborated with government, with mental health and addictions, various people in education through both NL schools, the Department of Education, Newfoundland Lab for Teachers Association, a number of community organizations, and of course, people with lived experience. And these have all really shaped what we've done. And there's been so much valuable information from all these different perspectives that has been very, very helpful. And really, our goal is to meet the needs of our end users, which is mostly the youth, of course, as well as teachers and parents. So just to summarize a little bit about what we heard from youth and young adults when we spoke to them, who were from various regions from across the province. Some things that they identified is that, one, they don't get much education on substance use or cannabis. We asked about both. They identified that they want their education frequent, so more than just one time. They want it to be interactive and practical. They want it facilitated by relatable speakers. They wanted easy to understand as well as age appropriate, so starting young. And we've started our drug education in grade 4 to reflect this. And it wants to be equitable across the whole province. So every student, no matter what school they're in, has access. And we have developed an open access website, which we'll talk about in a little bit. We also spoke to teachers. So through the teachers, some of the main things that came out there is that, one, not all educators fully understand the principles of harm reduction. However, they did express that they're open to that approach. Both educators and students did express that they do need that harm reduction substance use education. The educators did say that they felt unprepared to teach students about substance use. And educators do want additional training around harm reduction, around substances, and support in order to really be able to support the teaching of the education. And this work was published as well, if you'd like to look at it in more detail. So that's a quick recap, because we want to get into telling you a little bit more about what our actual strategy looks like. But some of the references are there, and you can look at some of the details if you're interested. So next, we just want to highlight is how we really honored all those stories that we heard and how that really shaped our DECYDE strategy. So we do have an open access website. I invite you all to take a look at that. It's at DECYDE.ca. And this DECYDE strategy, we're really looking at, or our vision is to empower youth to make safe and informed choices regarding their substance use health. And DECYDE stands for Drug Education Centered on Youth Decision Empowerment. So it's really trying to empower those students and youth to make safe and informed choices. And we look at our foundational principles, and we integrated all the feedback that we received from all the consultations and people that we spoke to develop these foundational principles, which carries through our work. So being evidence-informed is very important. Trauma-informed practices, that's using a strengths-based approach and understanding trauma and the impact on youth. Will's going to get into that in a little bit more. Looking at both primary prevention, but also harm reduction, to be realistic in terms of making sure that if students do make choices to use substances, they do it in a safe way. And skills-based health education, that's the other core into what we do, which Virginia will talk about in a little bit. And we just wanted to highlight this definition of harm reduction, which is a great quote that came from Choices for Youth. In the absence of perfect choices, we help people choose the one that causes the least harm. We do this so that we will have the opportunity to work with people again tomorrow. I think that's a pretty nice quote to think about how we frame everything. So we just wanted to introduce a local tragedy that occurred a number of years ago now. It's about 10 years ago here in this province. And this is a news article, so all the facts may not be completely accurate, but this is what's available in the public. And I know people who did experience this particular tragedy, it still resonates with them to this day. And this is just one example of the impact that a tragedy can have on the community, on the school, the youth, the teachers, and everyone involved. So this is unfortunately, a teen did die who was from CBS area. And what happened was the teen pretty much was found unresponsive after drinking alcohol. And unfortunately, they died when they did end up going to the hospital. And if you look at the snippet there on the right-hand side, the news article highlights how the teen did consume a large amount of alcohol before they died, and the importance of talking to your kids about what drugs can do, including alcohol, of course. And it's important for adults to initiate conversations. So how are youth going to know what to do when a tragedy happens if adults are not having the conversations and giving them the information and the skills to make decisions? So they need to know the dangers of alcohol, drugs, drug under the influence, all of those things. And it's something like this that it takes something like this to heighten the awareness. And you just think about the impact of a death that occurs on a teen in the school. And we've just highlighted a few considerations to think about. I mean, the students have those immediate needs because they're dealing with that. You know, this is traumatic. Think about all the children or the youth who were at that party where the youth died. You know, they may be coping themselves, dealing with the trauma. You know, there's impacts of stigma, stigma against the potentially the family, against the youth who were part of a hockey team, the school, the area. And then, of course, the teachers need those needs. Like, how do they support both themselves as well as the students? And, some students may be acting out in the classroom, and this could, not necessarily appear immediately. This could be a year later. And, teachers also have the duty to report. They have to think about their own referral and supports and empathic strain that can occur with that. So we just want you to think about those types of things that can happen, immediately, but also more long term. And Will's going to take over now, just talking a little bit more about the scenario.
Yeah, I'm going to talk a bit about adverse childhood experiences, trauma, and trauma-informed practices. And I guess as I'm talking about this, I hope folks can consider the scenario that Lisa shared and consider how we could think about the role of adverse childhood experiences, trauma-informed practices, and the impact of trauma in relation to that situation, and possibly discuss it after. So I want to start, many of you may have heard this analogy of the invisible backpack. I really love this story and this way of thinking about trauma and the things that we all carry with us. Each person is carrying struggles, challenges, fears, trauma, abuse, losses, all these burdens and challenges that others are not aware of and that others can't see. We ourselves may not even be aware of the weight that we carry ourselves. All of us are carrying invisible backpacks loaded down with all this stuff. And just because somebody is carrying it well, doesn't mean that they're not struggling. It doesn't mean that it's not heavy. it doesn't mean that it's not weighing them down and affecting them. It's of utmost importance that we offer grace, kindness, compassion, and forgiveness to those around us, as well as to offering that to ourselves, particularly grace to ourselves. And when we're able to be honest with each other and we have conversations and dialogues and we're able to share what some of these struggles are, it lightens the load. We're able to share it between us and we can help each other carry these invisible backpacks. When we talk about trauma, there's many definitions between the ICD-10, or what are we on, 11 now, I guess, and the DSM-5 TR. I really like breaking it down this way because we can get like awful bogged down in details on what constitutes trauma and what doesn't. When we think about trauma, trauma is not what happens to you, it's what happens inside you. We have traumatic events, and those can create trauma within us. It's an emotional response, also possibly a behavioral response that's experienced by the individual. It can be from a series of events or set of circumstances, things that are physically or emotionally harmful, or life-threatening. It doesn't necessarily have to be life-threatening, but it just has to affect our sense of safety and well-being. It can be one big event, and it can be several small events. And it's not just things that happen to you, it's what doesn't happen. Things like neglect has lasting adverse effects on our functioning and our development. It can affect our mental, physical, social, emotional, spiritual well-being. It affects our development, and it can cause things like impulsivity, difficulty regulating emotions. It puts our fear response system into overdrive, and it's like revving an engine just nonstop. And just like an engine's not designed to do that, we aren't designed to do that as humans, and it can really have this degenerative effect on our physical and mental well-being. Adverse childhood experiences. This is kind of, both those things that happen to you as well as things that don't happen during childhood. This comes from a study of stressful and traumatic events happening between the ages of 0 and 17. And they kind of broke it down into these broad categories that also includes like some community experience as well, things like experiencing prejudice, bias, violence in the community. How a child is affected by these depends on the type of ACE and how much distress it causes. And like I said, it's both what happens to you, things like abuse, whether it's emotional, physical, or sexual, and also includes things like neglect, not having your physical or emotional needs met. Growing up with a household with a parent or caregiver who uses substances, possibly, maybe somebody who's incarcerated, domestic violence within the home, even if it's not directly directed at the child, or someone being absent from the home for whatever reason. All of these things can really shape our stories and experiences as we go through life and how we're able to bounce back from future traumas. When we talk about trauma, particularly adverse childhood experiences and substance use health, kind of any ACE score, just experiencing one adverse childhood experience can make someone 2 to 4 times more likely to initiate substance use at an early age. And we know that the age of first initiation of substance use is a strong predictor of whether or not you're going to develop a substance use disorder or addiction down the road. ACE scores of 5 or more, you're up to 10 times more likely to experience an addiction or a substance use disorder. And as ACE scores increase, the risk for chronic pain and serious health conditions increase, as well as mental health struggles, and the risk of misuse of prescription medication or higher risk use of substances. I say this, it's not a crystal ball. That everyone who has experienced this is going to have these issues, but it does make you more vulnerable to developing a dangerous relationship with substances. So from a neurobiological standpoint, students can't learn if they don't feel safe, known, and cared for within their schools. Like I said, those ACEs and trauma in general can leave your fear response system just revved up all the time. And when it's revved up, you have a lot of difficulty encoding memories, difficulty with recall of memories, and difficulty with cognitive processing. So all of that can be a recipe for school just not, almost going in one ear and out the other, because you're just not able to hang on to the information. Traumatic experiences affect everyone differently, and we should not judge what we think is traumatic to the child. I'll talk a little bit more about it, I think, but sometimes recognizing that behaviors are very much related to what's going on inside the individual. Sometimes, all we see is the behavior, and we just want the behavior to stop if it's acting out. But we really need to recognize what's going on inside, and sometimes reflecting on that. You may have to address the behavior, but also asking, like, hey, I've noticed like you're blowing up a lot. You seem very agitated and short with everyone. What's going on? Are things going on at home? Just checking in and recognizing that, like, that's coming from a place. And it assures we don't lose connections when we respond in a trauma-informed way, and it builds that safety, and it can tamp down some of that neurobiological response. So how do we do that? I love the acronym SNAP Adults. So just having one person, one trusted adult in a child's life lowers the impact of adverse childhood experiences, because it helps them be able to process it and make sense of it instead of it becoming overwhelming. So adults who are safe, nurturing, available, and predictable. These are kind of the 4 ways that we can really help students, just trying to respond in a very predictable way, being available as much as possible. I know there's times when you're just not going to be able to attend to something right in the moment, but being able to say, I want to make time for you, in between these 2 periods, come back. And if you do make that promise, you really have to follow through on that, and just being nurturing and trying to dig at, what's going on, like, how can I help you? The impacts of this, it improves the self-efficacy, self-esteem, and it makes kids more likely to seek out other supports beyond you, and feel more comfortable with other people to be able to get help, and helps with those expression of emotions as well as regulating emotions. Trauma-informed practices. Understanding trauma, it helps us to be more responsive, implementing effective trauma-sensitive strategies and interventions, respecting people's stories, recognizing that trauma is part of people's stories, can really help to foster an environment where a child can feel safe, because, we're starting from that place of, like, hey, I need to help this child feel safe. And that's what's really going on here. They don't feel safe. Using a trauma-informed lens allows us to recognize and not misinterpret why a child is acting a certain way, and really be able to respond more effectively by moving away from the behavior to, like, hey, like, what's up? Trauma-informed practices in the classroom, incorporating a structured learning environment is very key. The more structure we can give students, the better. They may not be getting any structure at home if they're in a very chaotic environment. We want to be supportive, safe, and positive in our learning environments, offering encouragement where we can, and avoiding more restorative practices, less punishment and isolation. Anywhere that we can, incorporating social emotional learning strategies, which is a part of DECYDE, the curriculum that has been developed, and just fostering positive self-concept and encouraging kids to explore identity and find their place in the world. And like I said, using restorative practices as much as possible. We need to treat trauma-informed practice as a universal precaution. We need to treat everyone as though with the expectation that have probably experienced some sort of trauma throughout their lives, and that probably impacts them at some level. Just like if there was a spill of blood in the hallway here in my office, I'm not going to take a sample and send it off to Ottawa to test it for bloodborne pathogens to find out if I should wear gloves. I am just going to wear gloves and treat that situation as though there could be bloodborne pathogens and protect myself and others. Yeah. You know, we're pre-recording this, so I can't ask for comments right now, but something to think about, you know, possibly for discussion and questions. How do we see stigma evolving in this scenario? I'm going to talk a little bit more about stigma and how that can attach to individuals, the reputation of their group, reputation of the school, reputation of the family, just how that can impact well, impact everyone, really. So stigma is a huge barrier to asking for help. Kids may feel shamed, judged for substance use or other mental health struggles as well, and may isolate themselves if they don't feel like they can talk to someone about it, if they don't feel like they can trust to disclose that. It can cause you to conceal their substance use, to use alone. It can increase their risk of drug poisoning. We do know that we have a very toxic drug supply these days, and when people are using alone, there's so much increased risk of a poisoning event and not being able to respond to that, and may prevent them seeking help. They may feel uncomfortable engaging in classroom discussion, speaking to teachers, worrying about what others think, and it may also prevent them from talking about, you know, others' substance use, you know, such as caregivers, and be able to get support with coping with that. The more open we are, the less likely kids will be to feel isolated, because when you feel isolated, you will make that your reality. I know for myself, I struggled with alcohol and really became interested in doing something about that a few years ago. And I felt very isolated. I felt like I couldn't talk to anyone. There was nobody I could turn to. Objectively, that wasn't true, but that was how I felt. And I made it a reality. And when I did ask for help, my fears were confirmed. My family doctor told me that I should just quit drinking. That was not helpful advice, and I isolated further, and it was another year before I did anything about it. And it wasn't until I sought help that acknowledged that trauma was at the root of my struggles that I was able to get help into recovery and be doing fantastic now, I think. But that happens to anyone. When you feel that isolation, we don't respond in a trauma-informed way, it pushes people into isolation and puts them at higher risk of things getting worse. So how can we help decrease stigma? First and foremost, using person-first language, setting positive examples. Instead of drug user or addict, it's someone who uses substances. Instead of relapse, recurrence of use. Instead of a person with substance use disorder, avoid victim blaming, avoid stereotypes of that this is a moral issue, that it's just as easy as just quitting, because it's not. I wouldn't have a job if it was that easy, and neither would a lot of us. So really recognizing that you know, it's the relationships with substance use, they come from a place. And we need to respond to that and not focus on that it's just as easy as just quitting, and recognize also that substance use is here to stay. People are going to use substances, and it is a part of our society. We want to support youth, have open conversations, also inquire if you are concerned, you know, expressing that, like, hey, like, I've noticed this and this. Do you want to talk about it? And foster self-care, self-acceptance, help them develop confidence, and you know, comfort in their own skin to be able to to make their own informed choices and hopefully seek support. And I will turn it over to Virginia.
Excellent. So this is a great place when we talk about fostering self-care and support to also think about the impact on us as educators and teachers. And I've recently had the opportunity to be with some teachers from Atlantic provinces, and I can tell you that the concerns that we hear are pretty similar. So if you are in a teaching or educator role, or even administration, if you work in a building with youth and children, by nature and design, you are most likely an empath. Hopefully you are. You may be academically gifted and very brilliant at your teachable subject, but the driving force in your profession is probably your connection to the people that you teach or learn with. So as such, handling a sort of a topic like this and, from a restorative justice lens where we seek to connect, everything we do is based on connection and relationship building. So when we talk about these big, heavy topics, there's a real, absolutely genuine risk of this empathic strain. We are empaths by nature, like you say, most of us would easily identify. Probably even some of us stream the TED Talks by Brene Brown and other people like that. So, when we talk about empathic strain, it's a true hazard. And I can tell you that educators, it's no surprise, we face burnout right now at a higher rate than has ever been seen nationally. And there's a lot of reasons for that. So the work that we do, for people in helping professions, we have to be very, very, very aware of the impact on ourselves and sort of how to, be aware of what we may process ourselves as we try to connect with people and take care of people. You've probably heard of the oxygen mask scenario. If you're on a plane and the oxygen mask drop, you have to put yours on first. I struggled with that. I'm a parent of a child, and I used to think if I was on a plane and the mask dropped, I would automatically cover my child's mouth. But you know something? You can't. The best chance of helping out in a crisis or in a situation is to take care of yourself first. That is absolutely essential as educators. We are modeling by design how we deal with stress to these children and youth. And so taking care of ourselves is very, very important. So we've got some tips for coping with empathic strain. We have to focus on making healthy choices. And remember, when we do these things, we're also modeling this to our students and youth. We have to practice self-compassion. Of course, staying grounded in what we do. Be very aware of our own feelings that we bring into the room. We have to remember too, it's okay to say no. How often do we maybe overextend our own selves? And I know I'm a new teacher. It's very easy for me to be the person with the hand up, volunteering to do things. I enjoy that, but I had to be very aware of my limitations. We also may have some unhelpful coping skills, and that's something we have to be aware of. Again, everything that we do, we model to the children and youth that we work with. And we do absolutely have to find time for the self-care piece. There are a million different ways to do self-care. I find that the very first step for me is to have the awareness that, I might need to do something. Maybe I'm going to throw on some music, a podcast, take a walk, a bath. There's a million things. And I think, we probably all know what they are, but there's a difference in knowing what they are and actually taking the step to do them. So it's essential. So when we look at DECYDE, the actual, program itself, the way that it's been designed has been done with educators in mind. We use skills-based health education. So when we look at the content that was delivered and is being delivered to the teachers, it is comprehensive. It is absolutely cross-curricular. It's got many, many things. It meets like curriculum standards and updated ones too, very important to note. So in a nutshell, and it's hard to give a nutshell because it is so large, but we have lesson plans. They are comprehensive. They are interactive. And again, I know this is recorded. We will encourage you absolutely to go in and have a deeper look at this, but we will get to show you some. These lesson plans are interactive and they do align with the provincial health outcomes. And that is such a big deal as a teacher who's looking to pull resources and use them sort of, in a meaningful way. So the student activities too are great. They're based on scenarios. And again, those are data mined from these youth advisory panels. The DECYDE program takes the feedback from the youth. It is current and it's driven by what they say they want to talk about, what they want to learn about, and how they want to learn. And as an educator, if you're listening to and being guided by student voices, you're going the right direction. So by interactive, we don't just sort of deliver content and say, these are the drugs and here's what you need to know and don't use them. We have some of the content's gamified. We have interaction, discussions, projects, quizzes, and then all of that is also supplemented with a wealth of educator resources. So now I bet you're really curious and you're going to want to have a look at these things. Again, tying back to the skills-based health education is huge. We use a FACE decision-making model, again, with the ACEs and TIPS. And we provide things like substance snapshots. So the skills-based health education is an emphasis placed on learning skills that will promote and protect student health and well-being. And that's absolutely key. And again, we look at like discussions, role-playing, brainstorming, gamification, group work, case studies, debating, storytelling. And honestly, in the design of the content, we have looked to include all different learning styles and even exceptionalities, learning differences, challenges, so that as a teacher, when you pull the resources off, you've got different ways to approach it. It is quite comprehensive. Okay, so there's some tips here on the screen. I'll let you guys read those later on how to deliver skills-based health education. Moving on, those resources that we mentioned. We've got evidence-based educator resources. Some of them cover topics like empathic strain, harm reduction, neurodivergence, self-care, etc. And so we have these sheets, and you may have already noticed in the presentation, but there's links provided to different sites or different parts of our website. And the teacher resources are fantastic, and they're available. And the really neat thing I find, they're not just available to educators, and we'll talk about that in a second as well. So moving along, I'll give you an example now. We provide substance snapshots so that for the various substances, there's a 2-pager with the same look and feel so that the content is almost predictable. It's very comfortable as an educator to look at it because once I've seen one, I can look for another one, pull it up, and I know what to expect in layout, which is, makes it very much easier for me to then learn and then be able to deliver. So they feature some different, substances such as, cannabinoids, stimulants, etc. And you can see some samples there on the right. And again, we would encourage you to go in and definitely have a look. And I'm going to turn it over to Lisa.
Great. Thanks, Virginia. So I know we only have a few minutes left, so I'll quickly go through the last few things that we want to share with you. One, we wanted to highlight, and we've already mentioned this, how youth have informed what we've done. And this is just an example of one of our youth advisory panel meetings. And we use a Jamboard where they shared ideas around things that we could cover around healthy and unhealthy ways of coping. So one idea was a loss of a loved one or a pet. So we did incorporate that into one of our learning activities in grade 7. And the other example we've shared here is looking at social media and the pressures that occur through that. And this is another scenario for grade 7 that we have around fear of missing out and potentially using substances to help with that. And these are all available on our website, so you can certainly access them. And in the interest of time, I won't go through them in more detail. The other big thing that we're very proud of creating is this decision-making model. So we did an environmental scan looking for a good decision-making model that incorporates the social-emotional learning, the responsible decision-making, interpersonal communication, as well as reflection. And that's evidence informed. So doing that environmental scan, looking at the evidence, we did develop this FACE decision-making model that we're carrying through all of our lesson plans. That way it's consistent for teachers as well as for students. And the idea is that they would hopefully use this decision-making in any aspects of their life, of course, around substances, but other aspects as well. So FACE stands for feel, assess, choose, and evaluate. And this is just one example of a lesson plan, a grade 7 lesson plan. And this scenario is around Jordan, who's considering vaping. So looking at Jordan, whose home has been filled with tense atmosphere of his parents' frequent arguments, adding stress to their daily lives and disrupting their ability to get a good night's sleep. To cope with this, Jordan finds comfort in watching his favorite streamer on social media, who uses nicotine vaping for relaxation. So forced with their own stressors, Jordan wonders whether trying nicotine vapes could offer them some relief. What decision should Jordan make? And then the students then would go through, how they would feel, they would assess the situation, think about the different options, then choose the safest option, and then of course, evaluate and reflection at the end. So that's an example of how FACE would work. This would be where the teacher would model this particular scenario, and then we have a number of others that the students can work on either individually or in groups and work through FACE. And they're all age appropriate. So we have them from grades 4 onwards. And like I said, they would be tailored for the age level. So I just want to quickly, in the last couple of minutes, just talk about our next steps for DECYDE. One, teacher professional learning is a huge part of what we want to do. So we've already delivered presentations and workshops and did other professional learning workshops for teachers, and we'd love to reach every educator in the province. So let them know about the work that we have, as well as the lesson plans and all the resources that are available for teachers. So keep your eyes out for other presentations on that regard. We did just receive some funding to translate our lesson plans and materials into French. So those of you who may teach with French students, then this will be available over the next several months to year. So we just received that funding, so we're starting to translate that. So that's very exciting. So keep your eyes out for that. We also just formed a steering committee, and that has a number of important stakeholders that we have listed here that are more efficiently helping to guide the strategies, direction, and sustainability of DECYDE. And as you can see here, the Department of Education is core on that as well. And they do endorse our materials, and they actually have us listed as a recommended resource in the new health curriculum outcomes that will be released shortly. So it's exciting. So we just pilot tested grades 4, 5, and 7, because they're the 3 that we had done this past year, and we received feedback, and we're making modifications to the lesson plans based on the pilot testing from the teachers who did use the resources. We are finishing off grades 6, 8, and 9 this summer, so we are looking to pilot test them in the fall. If anyone's interested, please reach out and let us know if they're being interested in doing some pilot tests in those grades. And our email is decide@mun.ca, or you can Google DECYDE and you can find our website and contact us through there. As well, we want more widespread implementation across our province, of course, but also across the country. Anyone at all is welcome to use our resources. And the last kind of quick thing is that we're also trying to do more things in the community and reach out more broadly. So one thing that we're working on now is developing something called caregiver cafes, which is really giving caregivers, so parents, guardians, or anyone who is mentoring youth, to really help them come together and learn about substance use and topics related to safe decision making and protective factors. So that's an exciting initiative that we're working on now. And lastly, I just need to acknowledge all the wonderful team that we have. Will and Virginia are on the line, but of course, it takes a village to do something like this. So we have a lot of people there that we couldn't do this without everybody's input and into our strategy. We do have an annual report that's on our website. I invite you all to take a look at that as well. It really quickly summarizes all the key milestones that have happened over the past year and summarizes some of our resources and materials in a little bit more detail. So that's open, available for anybody to take a look at. And I'll just close with this nice quote from Lindsay Sterling saying, "We can always make a difference to someone, no matter what role we play." So thank you all for listening to our presentation. Hopefully we share some useful information and think about some things that we can discuss when we do have our live panel and discussion with you all. So thank you again, and looking forward to chatting with you when we come together.
Thank you very much.
Thank you, everybody.